Hello guys, welcome to my channel. Make sure before you start hit that like and subscribe button. Let's go. So with me here today I have Medhavi, and she is a nurse. So
Hi, I'm Midlavi. I'm a nurse and I have been working for 5 months so far. And I work in surgical oncology.
okay, so what does that mean?
Wait, what does what mean?
Surgical oncology or whatever.
So oncology is cancer related medicine. So I work on an oncology floor. So all of my patients have some kind of history of cancer, or they currently have cancer that's like ongoing. And since it's a surgical oncology for all the patients, almost all of them are either getting surgery or they've gotten surgery. So that's what they're there for, and that's what we're treating them for.
Okay, and how long is extra school, not including college, for nursing? Like for doctors, it could be like 11 years or something. Is there a different amount for nursing? Is there like nursing school?
No. So depends when you go to nursing school. You can go into a direct nursing program right after college. Like when you pick your major, you can pick nursing as your major and already be in the nursing school when you start college. So by the time you're done with college, you'll get your nursing degree. Some people decide they want to do nursing later on, or they end up applying to nursing school after like regular. Wait, I forgot where I left it.
And in nursing,
Oh,
so
yeah.
do
So you
people the in nursing do people like so is it like surgery where in the beginning of the day you take rounds, then you do your stuff, or in nursing you just do what the doctor tells you to do?
so when you come into your shift, you look at your patients, and we don't do rounds. We kind of just do reports. So you have the if you're going into day shift, then you'll have the night shift nurse give you a report on your patients, tell you about them. Or if you're coming into night shift, then the day shift nurse will give you a report. And you take a look at everything that the patient has going on, their history, their problems that they're in the hospital for, how their entire assessment is, any important medications or orders that you have to watch out for, and a whole bunch of nursing details that you learn in school and on the job. But like doctors, where you do rounds in the day and then they just kind of put orders in throughout the day, nurses are with the patients all day during the whole shift, and you're the ones giving the medications based on whatever orders are in the patient's chart. And a lot of times, depending on how the patient's doing, you're the one asking the doctors to put in certain orders or to fix some orders. You kind of suggest them orders, and then they'll put more orders in for the patient if they need like a new medication, or if something is not working for them and they want to change it, based on that.
And who is telling you all this information about the patients? Like you were saying in the shift, somebody's telling you that information when you start. Who's telling you this information?
That's the nurse that you're getting report from. Otherwise, if you're getting a patient for the first time from like the emergency room, sometimes we don't even, most of the time we don't get reports. So you kind of have to look everything up about the patient yourself because you have no information on them.
Okay, and so what's a day in the life for you, and how long are the shifts?
The shifts are 12 and a half hours, but it usually ends up being more like 13 and a half hours. Because by the time you're done giving report or when you come a few minutes early, ends up being a pretty long shift. But basically, when you start your shift, in the first like 30-40 minutes, you get report on the patients that you'll be getting. And then around once 8 o'clock hits, that's when I start giving medications to my patients for the 8 o'clock, 9 o'clock medication hour. And then because where I work, you can give medications in the hour before and the hour after. So if it's a 9 o'clock medication, I have an hour window before 9 and after 9 to give it. So I try to get them out as early as I can. So I usually have 4 patients. So I'll look at the medications, grab them from wherever I need to get them from. And before that, I also look through all my patients' orders because sometimes when they give you a report, they might miss things. And then once 8 o'clock hits, I start my med pass. And when I'm doing medications, I also do a full head to toe assessment of the patient. Like, I make sure they're neurologically okay. I listen to their heart, lungs. I listen to their abdomen, make sure their GI system is working, or if we're monitoring for issues with that, then I go over that. I check my patients' pulses, check for any swelling in their feet. I make sure they have their compression stockings on. I check all of their IVs. And since I work on a cancer floor, a lot of the patients have ports, which is like a little, it's not like an IV, it's a type of catheter where you can get blood access, but it's closer to your heart. So you have to be very careful with infection control, and you have to make sure that when you pull a syringe back, that blood comes back out to make sure it's in the right spot. So taking care of the ports, sometimes people have PICC lines, midlines, making sure that all of those work, and making sure that they're not too old. I do that. If patients are on fluids, then I replace the fluids bags. And yeah, that's mostly that first med pass, the first couple hours. It's usually the busiest at that time, especially if you get a new patient come in at that time. So it gets a little overwhelming and chaotic.
Okay, and so you said like you check their pulse. Is there like I know one way to check the pulse is to feel it in your neck over here. And I saw that they do that in emergencies. Is there a different way, like when they're if is there any other way to check pulse? Or are there
Yeah,
any
you have a
machines?
lot of different places where you can feel a pulse. I don't really do the neck. I always do the wrists to check the radial pulse, and I check pedal pulses. So you can, there's a few spots on your feet where you can check pulses. You can also check, I think, behind the knee, in the femoral area. You can also check brachial, which is kind of like in the fold of your elbow. That one's a little bit harder to feel. But I just try to do the quick basics. I do the feet and the wrists because I make sure that your blood flow is reaching your extremities, like your arms and legs, properly, that there's no issues there, and that there's no swelling. So that's usually what I check. And then there's usually medications like through the rest of the shift, like spread out, maybe 2, 3 a.m., 1 a.m. And then usually around 5, since I work night shift right now, around 5 is when sometimes if patients have 6 o'clock medications, I'll give those, and I'll try to get at least 1 or 2 patients washed up for the day if I can. And if they have PICC lines or ports, then I do blood work from those lines, send that in, and then usually we have 6 o'clock, 7:30 meds. But on my floor, we give 7 o'clock medications with the shift before so that it helps out the oncoming shift. So it's usually just busy when things aren't going smooth, or if a patient has issues coming, or if they start having cardiac issues, and a lot of monitoring, usually every 4 hours, if they have catheters in or drains in, or if they have like an NG tube that goes in from the nose to the stomach, any kinds of drains, tubes, bags, we keep track of those every 4 hours.
And say, so on your floor, you said you work in like cancer surgery. So are you? So on your floor, is it kind of like people who are about to get surgery and people who are done getting surgery, or is it like just a certain? So like, what type of people are you watching?
We get both people going to surgery and people after surgery. And sometimes people might be getting multiple procedures done, so sometimes they're in between. So it's before, after.
Okay, and so is your floor kind of an inpatient room, or is it like?
Yeah.
Oh, okay, yeah. So, so yeah, and so you said, so I don't know if you already said this, but what's like? So when you walk in, you do you from 9 or 8, and how much so that time is like a schedule, like you said, from 9 or from 8, you like do like go around and check everybody. So is it like a schedule that there's certain times that you do stuff, or is it
Yeah.
just okay?
All medications are scheduled for certain times. You have to get those within that time frame. And then there's like other things like your assessment, or if patients need like wound dressings done, or if they have like surgical incisions, if you have to fix dressings for that. I try to do it all together with my assessment too, but sometimes it takes time and you have to come back, or things happen and you have to be flexible.
Yeah. So have you ever so I said you're in surgery. Do you ever like go into the OR and assist the surgeons, or OR nurses like strictly like for the recovery and before the surgery?
No, so since I'm on the inpatient floor, I don't go near the OR. They have separate nurses for pre-op and post-op, like for patients that need care before the operating room and after the operating room. And then there are OR nurses that are actually inside the surgery helping the surgeons. So there's different nurses for each stage of care before surgery, during surgery, after surgery, and then the inpatient floor where you might be staying to recover if you need more time in the hospital.
And this could be subjective to just your hospital. For is there how many, like, is there just one inpatient floor, or are there many? And if there are many, are they like each floor is for like a different type of patient?
All hospitals have a lot of inpatient floors. There might be different specialties for each floors, or they might just be regular med surge. So at my hospital, every floor is like a different specialty. So mine is surgical oncology. Some floors might be, there's a medical oncology floor, so that's where they give them like chemotherapy and radiation therapy too. Then we also have like renal floors where people might be getting like dialysis and stuff. Then there's like different kinds of ICUs. There's ED, there's labor and delivery, there's pediatric floors, there's NICU for babies. It's all different specialty.
Okay, and in the hospital, do you get because you're in the inpatient floor, so it might be more relaxed. Do you get like special? Because you said your day is kind of planned out, so do you get like special like breaks, or you could like go to the cafeteria? Oh, okay. No.
It's inpatient floor is pretty rough. I feel like I would love to work outpatient. It's much more relaxing, and it's not relaxing, but it's a lot more chill compared to inpatient nursing. I think that's why there's like a lot of people that leave, because a lot of hospitals inside, it's like you'll get a lot of patients, so it's just heavy patients. It's a lot to handle.
Okay.
So, you don't always get breaks. You don't, like, there have been a lot of shifts where I never got to take a break. There's one shift where I never used the bathroom the whole shift.
Oh, okay.
It was so busy.
And is there so you said what's the difference between an inpatient and outpatient?
Inpatient is anything where you're staying in the hospital, like you're staying for like a day, 2 days, or maybe long term. We've had patients stay here for months even. And you're staying there overnight. Outpatient is like when you go to like a clinic or an office, you're just there to get checked up or get like a little procedure done or whatever you need to do, and then you go back home.
Okay, so is there a special also you said you work in inpatient. Is there like is there an option to change in case you wanted to do OR or whatever else you would like to do? Is there like an option to change, or once you do it?
Yeah.
Okay.
You can change. I think we have the minimum is 6 months. You have to work in that current position, and after 6 months, you can switch to a different floor as long as you apply and you get accepted. So I had a coworker. She worked on my floor for 6 months, and then she wanted to work with kids, so she switched to the pediatric floor. I know some nurses, they'll switch to like the OR. For the OR at my hospital, you have almost, I think, 9 months of special training just for the OR.
Yeah.
So anything in like a big major hospital, there's more like training involved, and it's rough on any floor, but a lot of people kind of switch between specialties if they can, or once they get sick of their current one, or if they don't like the work environment, then maybe they'll switch to a different specialty and try it out. Some people might switch hospitals altogether, but you can always switch. That's a good thing. Some people don't even work with patients. Some people work from home. Some people work maybe a few times a month. Some people do travel nursing. There's more options.
And for the people who don't work, what would you do if you don't work? Would you be doing like what would you be doing?
I don't know exactly what their day-to-day looks like, but some of the positions I do know that might be work from home or like a corporate like office job. I know there's like case management. A lot of nurses do case management. There's like medical device sales. People work with like certain like biomedical engineering companies like Stryker. Some nurses work as like navigators, or like they'll do management type of jobs for the hospitals. Some people do like navigator or coordinator jobs for certain things. There's also legal consultant nurses. They'll do more like legal stuff. They'll work with lawyers. So there's a lot of options out there.
And you said
people also work with like pharmaceutical companies.
Okay, and you said you worked in the night shift. Do you also get to choose the shifts you're gonna work in?
Sometimes depends what you apply for. And also depends on the availability. So I already worked on my floor as a PCT, and at the time that I was hired, they only had night shift available. So I did night shift, and I'm gonna be moving to day shift next month. So I did basically 5 months of night shift, and then I'm gonna be on day shift, and yeah, it'll be a big change, but you get to learn at a more comfortable pace on night shift since it's not as busy as days.
Yeah. So yeah, I'd imagine night is a little calmer than days, but and so you said okay. So I know some doctors have like offices, or like they have an office. Not like some of them have offices, and like certain areas that they could work now, like and or like they're different and stuff. But do nurses have an office, or like what do they?
No, you kind of just get your locker in the break room where you can put your bags, and then you're just kind of working on the floor. If
Okay.
you find a computer, you just sit there a little bit before you have to get up again. So we don't really have like a fixed spot for doing work. You're just mostly with the patients.
Okay. So, and what's in the average nurses, like what do they carry to patients, like in their pocket or whatever, like what do they usually carry?
I always keep my stethoscope with me. I keep a pair of bandage scissors. I keep alcohol swabs, and we have these CHG caps. So it's like a little cap that we use to cover the opening of like the catheter of your IV catheter, just to prevent any infection with like IVs. Um, I also keep my work phone in one pocket, my personal phone in my other pocket, and I also keep a whole bunch of flushes on, because since I work in oncology, a lot of these patients um, get chemo before their stay, or they'll be getting chemo, but basically they don't necessarily always have good veins. So we try to always make sure that IVs are working. If they're not working, we take them out, put in new ones. And we also need a lot of flushes for like ports and PICC lines and stuff. So they're always handy to keep around.
Okay. And when you're working, so okay, so you so as a nurse, what you are doing, is there a way to say you didn't want to,
Your degree.
how do you like progress your career outside of nursing, like with your nursing degree?
So when I graduated from nursing school, I got my bachelor's of nursing with that was my undergraduate degree. Some people might go back to nursing school later and then they'll get like, associates. Wait one sec. Wait, pause the thing.
Okay. And as a nurse, do you do so what's the difference between, so when you're working with inpatients that can straight from the ER, what are you like are you like specially, or what I should say is like, are you checking on like patients with like things first, like is there like an order to check patients, or do you just check them in like whatever order you want to check them?
It kind of depends on the situation. Usually, when they come up during like, if they come up during the middle of like my med pass with my other patients, I get through whatever patient I'm with first, and then I'll pop in just to say hi to my patient, maybe if they need to get settled in, to make sure that they're okay and that they're stable. One of the PCTs usually comes in, or my charge nurse. Like my charge nurses are usually like really helpful. They're great. So they'll come in, make sure the patient is okay if I'm not there, and then I'll go back when I get a chance to look at their orders. If I need to give them any medications, I make sure their vitals are okay. I'll take a look at their history and what's going on. If they have any like tubes or drains, I'll take a look at that, and then we have to go through all their admission questions. If they have any forms to sign, we'll go over that. Make sure that they're tucked in, and then if I need to put them on like fluids, then I'll do that. If I need to put in like any extra IVs or anything, I'll do that. Usually by the time they come up to my floor, for the most part, they're stable enough that it's not like they don't send up a patient with like a life-threatening emergency. Like if they're not stable at all, they won't send them up to my floor. If it's that type of case, they'll like keep them in the ER a little bit longer to stabilize them, or if they need to, they might get sent up to like the ICU or something. But on my floor, we don't take care of like ICU level patients. If a patient gets to that level of if they're not stable and they need ICU level of care, then we would transfer them there. So it's kind of like depending on what that patient needs. On my patient, they're not going through something urgently like life-threatening, so we do what we can to get them settled for our floor and our level of care. So it's not like I'm rushing and like they're bleeding out or something, or their heart rate is like 200 or something. Usually not. If an emergency like that does happen, I call the rapid response team and they come in and take care of them.
And okay, and so this is the last question. What is when it's like 8 or 9 o'clock and you're checking the like the patients is there like do you go like to any room, like this kind of adds on to the question before, like are there like special like numbers for different rooms, like for example like east number 2 or like 060 or something? So are there like number rooms that like on a list of paper say um that organized and you check off after you're like done taking care of them, or like is it like
So basically, every every room is numbered, like room 1, 2, 3, whatever. We have 32 rooms on my floor, but all of like the care that the patient gets, we don't use papers. Everything is on the chart. And when we take care of the patients, it's not like, oh, like I check them out and done. It's not like that necessarily. You're constantly checking on the patient like periodically through the whole shift. So it's not like one and done necessarily. When it comes to which patient, like if I have room 1, room 3, 5, and then room 32, for example, in that corner of my floor, we don't get like our rooms assigned in number order. We get them assigned to us based on how acute the patient is, like how complicated the patient is, to make it fair for all the nurses. So that's why our rooms are kind of like spread out. So the other day I had like room 1, 3, 5, and then I had like room, I think like 17 or something. So those are my 4 patients. They're all spread out, but I'm gonna go check on them as I need to. But when I decide which patient to go to first, I usually decide to go to my patients that either have medications due the earliest, so I can get those done on time, or if everyone has medications due around the same time, then I'll go to the patient that's the least complicated, so that you can get all of their assessments, any fluids, bags, tubes, whatever that I need to check out and figure out. I can get those out of the way so that that patient is settled in and they're good to go for the next time I come to check on them. Or if they want to sleep, then they can go to sleep or whatnot. I'll make sure they're in bed. and then I'll go to the hardest patient last. Hardest meaning the patient that has the most complicated things going on. Like if I have to give them, for example, if it says TPN, that's basically when the patient is getting all of their nutrition through their IV, like through their port or their PICC line, or even if they have an IV, they're not getting nutrition like through their mouth. So if I have to hang something like that, and they have a whole bunch of other tubes, drains, whatnot that I have to handle, and they're on fluids and like pain medications and everything, I save that patient for like towards the end, because that will take the most time, and you can get stuck in that room for a long time, and you don't want to make all your other patients' medications late.
Okay,
So
and
that's kind of how I do. You
and
get the easy stuff out of the way first, and you save the hardest for last.
okay, and I said that would be the last question, but one more quick question about how many nurses that like are the same job as you are on your floor?
I don't know the exact number, but
Well, like on average.
for each shift, we usually have 9 to 11 nurses.
Also a lot.
Yeah, but there's a lot more staff because everyone doesn't work every day. We have to work 3 shifts a week.
Mm-hmm.
So the days that some people are off, there has to be enough staff, like to still have enough nurses every shift.
Okay. Okay.
So.
Okay, guys. Thank you for watching. Make sure you hit that like and subscribe button. See you later.